this discovery was significant in the context that it takes an awful long time to get drugs through approval by the US government, specifically the Food and Drug Administration. So for the FDA to say, well, for the first time in 40 years, we're going to allow this drug to be used specifically to treat multi-drug resistant TB is actually rather a big breakthrough. CSU's involvement in it was in the very early preclinical studies, where we showed that by itself, this drug, which is called bedaquiline, actually killed tuberculosis in test tubes. And then we went off and did more sophisticated assays with it. And we found two things. First of all, it was very effective in terms of curing the disease by itself. And if you mixed it in with conventional chemotherapy, then what happened was that the cure, the clearance of bacteria from the lungs, occurred in about 6 weeks, as opposed to 6 months if you used the conventional chemotherapy alone. So in other words, what we did with the drug was to show that it considerably reduces the duration of therapy, which was actually a very, very important observation. Johnson & Johnson, which is the company that owns bedaquiline, then went on and did clinical trials in human beings who had multi-drug resistant TB. And they basically found the same thing, that if they added bedaquiline to the regimen, these people cured much faster than if they were given the conventional drugs. So that was very gratifying, because it basically showed in the clinic, it confirmed the results that we had found earlier at Colorado State University.